robotics and artificial intelligence, all spheres of life are now talking about robotics. I am Dr. Ramneek Mahajan, Senior Director Orthopedics and Head of Joint Reconstruction Unit for Knee and Hips at Max Smart Super Speciality Hospital, New Delhi. We have just procured a Mako robot for our operation theatre. The Mako robot basically is the most advanced robot available. Since 2005, this has been in use in various shapes and forms. All the leading hospitals in the world use this particular software. This robot is the only robot available in the market which is for knee replacements, for hip replacements and for partial knee replacements. Now, over 125 cases that I have done with this, I have realized that there is definitely a change. What is the change? The first change is that I am seeing more patient satisfaction. My physiotherapy team is becoming more and more confident in the way they are handling these patients and seeing the outcomes. My doctors are post-operative rehabilitation. The patient satisfaction is definitely helping us. Now, what has changed? Basically, we have started doing CT scans for these patients. CT scan is then uploaded into a software which goes to a base lab available at the US. The US team does a segmentation for us. The segmentation sends us signals, the sizing, how much is the angulation and what is the perfect fit for that patient. Intraoperative, when we start a surgery, we register the points and we send the soft tissue data into the computer. Both of those things merge, patch, and we get the best fit for that patient, which is then used with the robotic arm. So this is the difference. We all know about robots where people would think that the surgeon is sitting somewhere else having a cup of coffee or sitting behind a console. No, this is the robot which actually is in my control. I am nowhere. I am the one who's doing the surgery. The robotic arm is in my hand, is in my control, and we take our cuts based on those designed. It's a haptic field. That means when I go in and I cut, I stay within those defined margins, do not violate the soft tissues. In this, the process, what happens? Probably it will help us, that is what I feel, in more patient satisfaction because of the precision, less tissue handling. It might actually end up giving better results to our patients. So this robot has basically helped us in achieving what we wanted to, and that was we at Max looking at patient satisfaction as the criteria, as the number one goal.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.